All right, well, good afternoon, everyone. Thank you for joining us all on the panel on redefining the patient and provider relationship in the age of healthcare consumerism. Before we get started, my name is Francois. Again, I'll be serving as your moderator. I'm a manager in EY's US healthcare practice, focusing on digital health strategy and innovation. Most of my day is spent around ideating, designing, and implementing virtual care solutions to improve the patient and provider experience and deliver better health outcomes. Setting some context for this discussion, in recent EY surveys, 57% of customers said that health products would become an important part of their shopping priorities, and 47% of patients expect in the next 10 years for virtual presence to be a substitute for in-person use cases. To discuss these trends, we have some 4 great innovators across the health ecosystem, so I'll give everyone a few minutes to introduce themselves. Do you want to go first?
Sure. Thanks for having me. My name is Julian. I'm founder of Avi Medical. We are a hybrid primary care provider, and it's basically our focus to build a first point of contact for all the health issues for patients, because we just observed that a lot of patients are basically lost in the system, and we want to provide this navigation, and we think that primary care is determined to be the primary provider for all those health issues and then coordinate in the system. And it's also the best ways to applicate technology in it, because there you have the most efficiency gains in bringing in technology in the patient communication and navigation.
Audrey, do you want to go next?
Yes, I'm Audrey. I'm CEO at Kley. We are a menstrual and reproductive health platform serving people from menarche all the way to menopause. About 10 million people, women and people with cycles globally, trust Kley to empower them to better understand their body and take action if that may be. And we've been a pioneer in the period tracking space for a while, and because of that, we have so much insight into the human, the patient, the consumer experience when it comes to navigating that. So excited for this talk.
Thanks, Audrey. Michael, do you want to go next?
Sure. Hi, I'm Michael. I work for Kliniken AG. I'm in charge of innovation and digitalization as part of corporate development. Kliniken AG is one of the largest integrated healthcare provider in Germany. So we have roughly 54 clinics that we own, so hospitals that we own, and more than 500 seats in outpatient care, providing every service alongside the continuum of care from prevention through outpatient, inpatient, aftercare, rehabilitation, long-term care. We have a lot of service organizations also that service not just our own hospitals, but hospitals in the market throughout Europe. Just recently expanded to Poland also with our procurement organization. We work a lot with startups and try to bring innovation to our healthcare professionals as well as our patients and improve the care that we provide through that.
Thanks, Michael. And then Marcin.
Yes, hello, my name is Marcin. I'm probably one of the few who are locals here, yes, based in Warsaw. I'm working for Abbott, particularly the core diagnostics, so the parts related with the in vitro diagnostic Abbott businesses. And there I'm leading we call it the franchise of digital health solutions in a few regions currently, but generally from Tallinn, Estonia to Tel Aviv. We are a part of the largest EMEA organization, which is the currently most innovative and successful in the world, from even leading the USO at the moment. So I believe you name us as innovators. Here I would like to name myself more like a practitioner, because all and all on this startup in the, let's say, environment here, in the end I'm for the last 5 years also dealing with the not a healthcare, but health services market and their players and their customers, like hospitals, networks, things like that. And probably I can add a few, let's say, less positive words into our story and challenges that are for a couple of years really stopping, in my opinion, the pace of the development, healthcare, digital healthcare development.
Perfect. Thank you, Marcin. All right, well, I think let's just dive straight into it. The panel is on redefining the patient-provider experience in healthcare consumerism. So let's start talking about that first. How has the rise of healthcare consumerism influenced the patient-provider relationship? And specifically for us today, with all these startups here, kind of what are the opportunities for those startups, for the healthcare systems, and the pharmaceuticals that exist today? Julian, do you want to go first?
Yeah, sure. I think a lot of times when we talk about healthcare, we think very complex about improving medical outcomes. But the first thing to do is increase the access to patients, because healthcare really is about what do patients do in the day-to-day. So we think in the clinic, we explain to them, we prescribe the best medication. But what really is healthcare is what do they do when they're in their home environment, right? We can tell them what to eat and what to do. They go home and their wife cooks something for them. They eat it. It's unhealthy, and this is their day-to-day. So we need to get into the daily life, and this is for me access, and access is nothing else but consumerism. Just seeing patients as a consumer means being close to them, and making access easy for them. So without having consumerism and access there, all the rest about improving medical outcomes is not really a question. So having that brought forward a lot over the past years enables us to do all the rest.
So it sounds to me like what you're saying is the difference in relationship is really bringing it to the home and defining that relationship not only in the clinic, but also how do you impact people in the home. Is that correct?
Yes, absolutely. Just seeing them as a consumer that you want to engage with, interact with, make it easy for them to access. So it's basically about engagements, creating touch points, and that's everywhere they are.
Thanks. And Audrey, I think you tackle that a lot with what you're currently doing. What are your thoughts, and what are the opportunities for you and some other players?
I think the rise of healthcare consumerism is actually about engaging people with their health. Like you mentioned, it actually happens even before you enter the healthcare provider space. We see that a lot specifically in women's health, where honestly, most of women's health is viewed as a lifestyle thing. It's wellness, or most people might say, I experience pain, severe pain regularly, every single cycle, and they're oh, it's not that bad. You're probably just PMSing. I mean, that is the women's health experience. And so when it comes to actually changing that, I think there's not only engagement from the consumer side, but there's also an important, I think, education from the provider side that's happening. I loved your points about representing the patient, and I'd like to think that I am a patient, but yes, thank you for the reminder that we may not be representative of that. So I brought one note today, which is actually, it's a user quote. A lot of what we do at Kley is we just try to understand what our users need, what their experiences are, how can we best support them. That's in essence our business model. That's what we also care about doing. And so I took something. This is actually posted to social media, and mind you, we get messages like this all the time, but this is from one of our users. I had been struggling with painful, long, irregular periods since 2013 and started using Kley about 2 years ago. A few months ago, I was able to bring 2 years of data to my new OBGYN, who reviewed my cycles and symptoms and was able to finally diagnose me with endometriosis. She goes on to say, my grandma and my mom also likely struggled with endo. They frequently missed travel opportunities and activities because of it, because it was too difficult to manage pain and symptoms without a diagnosis. So, Kley helped me understand my body better and advocate for myself in a clear way. Thank you. And I bring that because I think that, don't take it from me, take it from somebody who's actually going through this. What happens when you get engaged with a consumer, even a consumer health app, start tracking, start observing, start learning about what might be happening, then you can actually change the conversations that you have with providers. And endometriosis, for those that don't know, this isn't like a rare disease. It affects 10% of women, and on average, it takes 7 years to diagnose it. That's a long time to live with pain, various different other symptoms that honestly lead to significant changes in just quality of life, as well as how you might engage with the world around you and the relationships that you have.
Yeah, thanks, Audrey. And I guess going to you, Michael, and focusing more on the provider or health system side of things, kind of how are you redefining that relationship with your patients?
Right, and it's always beautiful at these conferences how people, push for patient centricity or consumerism in healthcare. At the end of the day, it puts customers or patients in the center of things, and I think it's something where we still have a lot of room for improvement. So the reality in the provision of healthcare in Germany, and I believe in most other countries, is more healthcare professional centricity still to this day, where we kind of build everything and focus everything around the short resource of healthcare providers or healthcare professionals that is now, with the boomer generation retiring, going to be even more scarce, where we, I believe, should focus more time also on improving the patient journey. And we are working on that, but it's a process. It takes time. Also, culturally, it takes a lot of time, especially in the hospitals. The most empowered patients, they tend to give up their free will at the check-in, basically, and then they're just, the patient. And I understand they're sick, they want to be cared for, and expect the professionals to do that. But it's sometimes all those brilliant ideas that we see here in those pitches, they are quite far from the reality that we actually experience out there in our practices, in our hospitals. And so when you put those solutions to the tests, it sometimes, I think, is difficult to get patients and as well as healthcare professionals to utilize them successfully. And that is, I think, something to really keep in mind, and something where we still have quite a long way to go.
Yeah, I like that. And I think you started talking and hinting at this, right? But one of the problems is kind of how does this get adopted? But then on the flip side is around access. And how do you ensure equitable access to the digital health solutions you are creating? So I guess, Marcin, to you, and a question for you is, how do you ensure that equitable access? And how are we going to ensure that that access isn't, and those digital health solutions are not further creating that divide between care and the people who need it the most?
I believe it's a very difficult question to answer just the right way and only one way. First of all, I would put it like that from my perspective. If I'm specializing in the in vitro diagnostic, means 80% of the clinical decisions are driven by results, lab, diagnostic results, doesn't matter. And these is the huge amount of data which is restricted, as you start mentioning, to the healthcare professionals, yes? From the other hand, the patients around, they trying to analyze it quite often just to see the reference site or just to ask Dr. Google what is behind. And then, this amount of data is unfortunately diluted. Means diluted between the places that are generating those data, but in most of the cases, of course, exceptions are existing, but most of the countries, most of the cases, we don't have a one big common clinical data sets that are accessible to all doctors in all clinics and so on. And that's why I believe that, this is partially a challenge, not only of the, let's say, mindset of the clinicians or the rulers or ecosystem, let's say, regulatory, healthcare ecosystem regulatory, but sometimes it's a really technical challenge. Someone on the previous call mentioned that, well, I'm in New York, I have access to all technologies. That's quite often one of the biggest issues we are dealing with, means so many technologies, so many legacy technologies that are still need to be used. They are storing data or being used by one, let's say, hospital or a network. Then we have the totally different use somewhere else. And to combine this, not only from technical, but some quite often from a, I would say, budget perspective, starting to be a biggest, let's say, challenge to overpass, especially in the public sectors. Yes, they are signing a multi-year contracts with their HIS providers, General Hospital Information System, and forgetting to put a small remark that, well, let's say I have still a budget for additional, I don't know, 10 integrations that I need to do in the future. Yes? Yeah. They spend the money, they close the contract, and in the end they are quite often under the wall because they would like to do something, they feel they need to, but they need to try find the budget sources different way than their own. Yes, also difference between the countries that I'm dealing with in case of the regulatory and approach of the country to share the data, for example, is okay in Czech, for example, you can do almost what you want, but in the other hand, in Saudi Arabia, quite often you can even don't have the access, remote access to your servers at the site you place it. Yes, you need to go physically there to fix it. So imagine how much, let's say, water in a river need to flow until they will agree to send those data somewhere else.
Yeah, I think that makes sense. So, and really what I'm hearing is a lot on the kind of provider side or on the system side. I guess looking at that equitable access more from a patient side and more from a consumer perspective. Audrey, how would kind of, what are your thoughts on that and ensuring that we're not leaving people behind and we're not leaving patients behind?
I would actually look at the access question like, I would ask 3 questions like, well, 1, is there a solution? Do people know about it? And then 3, can they afford it? It's like availability, awareness, and affordability. Those seem to be great things, great problems to solve in order to make sure that there is equitable access to different things. From a women's health perspective and from like a consumer of women's health perspective, I would say that like a lot of this is ensuring that there is both the data, and there is a big, let's say, gender data gap, that there is both data and funding and people doing research and people doing and people innovating in this space to solve the first one, which is that like, is there a solution for this thing? Is there a diagnostic? Is there a therapeutic? Is there care? Is there something to be done here? And the fact of the matter is that we're woefully behind on all of those things. There is a gender health gap. There's a gender funding gap when it comes to R&D. Like 1% of biopharma R&D goes towards women's health conditions, women's health specific conditions, even though the disease, and especially if you look at conditions where the disease burden is far heavier than it is compared to other disease, like research is just not funded there. So there's, first of all, an availability problem. Let's change what we fund, first of all. On the second piece, on the awareness front, I think this is a lot of what we do at Kley, is we try to educate people about their health, about what's going on in their body. And we also try to help make sure that they can track and observe it in a non-judgmental, inclusive, safe way. When you track your cycle in Kley, you can actually see, are there patterns? Do those patterns change? A lot of times when something changes, that's a signal for you to go and talk to a healthcare provider, and that's a great thing. And finally, on the affordability front, well, I think that loops back to the availability front and the fact that there isn't funding, and people oftentimes overlook the fact that something like menopause is a thing that literally everyone with a cycle will go through. And yet I hear, like in Germany, you're only reimbursed 14 euros as a healthcare provider to treat menopause for 3 months. Who's going to do that? I feel like there's something missing there. And so when you can unbreak this chain, well, honestly, when we choose to spend our money differently and look at the data available about, let's say, disease burden or what the actual impact is on quality of life, and have that health economics data, then we can actually make sure that all of this is accessible and fairly accessible to everyone.
Yeah, and I think a big solution from what I'm hearing is kind of data analysis and how next generation technologies or future-facing technologies can enable some of that access. So maybe shifting gears a little bit, and as we see all these startups around us, what is the role of these emerging technologies like artificial intelligence, like virtual reality, having on the patient-provider relationship as a whole? How do we anticipate that kind of changing that dynamic in the future for good? Julian, you want to take that?
Yeah, sure. So I think there's technology will take over more and more of this value delivery that we used to have between humans and humans only. And just to give you 2 examples, the first one is about the patient engagement, right? We need to be with the patient all the time, and that's just conversational AI, right? We are losing the patient in their day-to-day if we are not with them. Provider cannot be with them all the time because it's just physically not possible, but we need someone to be with them. And conversational AI has just gotten so good that they actually can guide and navigate. That's just one example. The other one is better diagnostics. So I'm a doctor myself. It's impossible nowadays as a doctor, especially in primary care, to oversee the range of therapies and diseases that there are. It's impossible, and it's just guidelines are changing constantly across the full spectrum. So we need to introduce AI there, or technology in general, to help our doctors take the right decision sooner, and then we can allocate the human resource in the healthcare system, which is medical workers, which is nurses, which is doctors, on those things that human beings should do, and that is maybe having the eye contact, having maybe the difficult talk with the patient, but all the rest we can basically put on technology.
Yeah, I love that answer, and I guess, Michael, shifting to you, right, adding on to it, and perhaps focusing our answer really on how that relationship changes. How is it that a patient and provider are going to interact as technology becomes a more integral part of that experience?
Right, and I fully agree with what Julian just said, and I think it's not actually a choice, but we have to really get more digitized, utilize the technology that we have at hand. And I said this earlier, but looking at our hospitals, within the next 10 years, 50% of our staff will retire. And we won't be able to, hire enough people back. And so we need to be more efficient, optimize, and free up space for the providers that are left to us to, interact with the patient more closely. And I believe that technology can eliminate a lot of the administrative burden. It can help with diagnostics. It can definitely just do a lot of the tasks more efficient and support clinical decision making to a point where healthcare providers will hopefully be more able to focus on the interaction with their patients in a social context and really guide them through this tough time and support them with all that is happening to them and around them. And that all supported by things like algorithms that help them find the diagnosis faster or better and alleviate the documentation burden and those things.
And we talk about a lot of these technologies like the algorithm, like AI, like virtual reality. And what are the key challenges in implementing those in the healthcare systems? And how can we kind of overcome them to make sure that we implement them faster and in a better format? Marcin, do you want to take this one?
Okay, so I would say that I see there like 3 challenges different. One technical, let's not go into the details that I mentioned previously, diluted environment technically, yes. And the integration of the data is necessary there, communication, so on. But this is something that it seems to be easy to bypass or go through. Then the second, regulatory. Means AI especially is totally unregulated market at the moment, and we can see even on the, let's say, commercial market far away from the healthcare, yes. We see that there is a big debate and a discussion, and then a lot of big forces and influences of the high-tech companies feeling that they are losing something. Well, in a healthcare environment or healthcare business, there are, I would even risk bigger powers that can influence, especially on regulatory, to just slow it down. How it will end up, this is of course open topic. And the third one, I believe the most, I would say discussable, means the clinicians itself, means we are talking about a very important, until the technology is the tool for them, they like to use it and they are fully, let's say, committed. But if there will, in a certain moment, appear something like clinical decision support, means I need to put my electronic signature on something that was fully created by the machine, let's call it like that, artificial intelligence or something, even without assessing this. Am I ready to do it? Yes. This is a question for if you ask for most of the clinicians, they will then start, let's say, going back and trying to withdraw from their initiate super big enthusiasm. Yes, of course, not always, but this is something that we, as I said, as a practitioners, observing on almost all markets. Means, of course, they are innovators and they are able to convince their colleagues that this is a way, because in the end, in a certain moment, those people can walk up in a day and find out that they have nothing to do anymore. Because the idea is that if in the first stage, let's say digital, AI or something like that, can take out the, I would say, the daily business things from the head of a high-level specialist who is a clinician, doctor, and make him focus only on those cases that are really severe. They are really complex and require this particular, yes, human particular, or how we can name it, and all, let's say, routine, leave where it is. My simple case, well, if your result of your glucose and the HDL and something else is in a reference norm, really no human need to look at it. It's just pressing enter, but disturbing those people from really severe cases, or lowering their focus to catch something that maybe is very important small element that will impact the diagnosis a lot. Yes, yeah. And those cases that Audrey mentioned.
Yeah, thank you so much. And I think we're out of time. I'm seeing the flashing red light. But thank you all for your time. And honestly would recommend everyone to talk with these four innovators. I've been in the healthcare industry for quite a while and have learned a ton preparing for this with them. So thank you for your time.
Thank you very much. We still have like a minute or two for a quick question for our panelists from the audience. Again, I promised there would be an opportunity for everyone. So if you have a question or two, maybe 2 minutes left. Anyone? Yeah, we have one. You can approach the mic.
So question for you all. You're all quite enlightened in that, you know, the AI will take place of these simpler diagnostics. It's inevitable. Doctors will be retiring. We're going to lose a lot of workforce. Platforms like yours bring so much value to these HCPs. How do we convince the HCPs without it taking a decade that they should in fact trust these systems, right? Because, you know, we talk about these enlightened experiences, but you walk into a doctor's office and it says, like, if you're going to quote Dr. Google, get out of my office.
Yeah, that's a very good question, and we have to address it like every day and trying to transform the way that we deliver healthcare. And you know, this change management with the healthcare providers is very, very tricky. You know, you have to kind of go with the digital champions, if you will, the ones that are willing to, you know, innovate and try out new ways of working and innovate and try out new technology. I mean, there's always going to be some doctors or healthcare provider that are opposed to new technology. They'll be like, I've done this, treated patients for the last 30, 40 years this way, and I've done it well, and I'm not going to change now that I'm 5 years before retirement. But we have to change now. Otherwise, we can wait till the pain gets so big that we'll finally get to it, but then we'll be in big trouble for taking care of our patients. And so I think we really need to start now urgently to implement these technologies to be more efficient and be ready for what is coming in the next 5-10 years.
Thank you very much, Michael. Anyone else would like to respond?
And it's a hockey stick, right? It's very simple. It's just going up. And maybe it takes another 10 years until it's like fully there, but that's fine, right? It's like for innovation, there's always first movers and laggers. So
Yeah, the only thing I would add really is, especially in the United States, as we see Gen AI implementation becoming much more common in health systems, providers are spending on average 16 minutes to update a patient profile after every patient encounter. So removing that administrative burden from the provider and allowing the provider to see more patients is just going to be a no-brainer.
Audrey, anything you would like to add? Not necessarily. No pressure.
I'm not a clinician or on the healthcare provider side, but I would say it seems like healthcare providers are pretty stressed. They're pretty strapped for time, and I think they would all appreciate help as long as it's developed in a responsible way, where it's evidence-based. You can see all of the safety considerations around it. I would like to think that people are ready to be helped.
Speaking of time, that's all we had time for. Thank you very much, Audrey. Thank you very much, Marcin, Michael, Julian, and Francois. Thank you.